Welcome to the Executive Innovation Show podcast, where we bring you real executive conversations with industry game changers and thought leaders. We ask the questions you're thinking, what you're scared to ask, and we make your brain hurt afterward. With your host, Carrie Chitsey Wells, co-founder and CEO of One Touch Video Chat, live video interviews, and the nonprofit Humans Helping Humans.
Hello, everybody, and welcome to today's podcast. We're going to be talking about rheumatologists and the broader access to telehealth specialty care brought to you by One Touch Telehealth. We've got amazing guests with us today. Have Dr. Diane Girnita, who's the founder and CEO of Rheumatologist OnCall, which is a direct care telemedicine company, actively seeing patients in 6 states. Our practice focus is highly personalized, evidence-based, and integrated medicine approach for patients with autoimmune diseases as well as arthritis. She provides instant access to specialty care through digital formats to meet the needs of her patients' lifestyle. Dr. Girnita, welcome to the show.
I'm very happy to be here, Carrie, and thank you for inviting me.
Yeah, so you're a pioneer and innovator, and really want to learn today about the ins and outs of how you're kind of flipping the table with rheumatologists using telehealth and doing direct care across multiple states, and things that you're doing outside of the box. Why don't we start of just kind of giving a little bit of the backstory of why you started this direct rheumatologist model and what led you to start doing things differently than folks that are just doing it in the old office?
Yes, Carrie, I will tell you my story. I was born in Romania, and I graduated medical school there as well. I started as a cardiologist, but in the time of my training, I got interested in immunology. So I came here in the United States with a passion to invest in some research, but then I was thinking that I will go back. But my life became, like everybody's life at the age of 20s, 30s, complicated. I got married, kids, and I realized that education is second to none here in the United States. So eventually, after I've done some research, I moved to clinical world again, and I rediscovered rheumatology, and I fall in love with this specialty. And after I graduated my fellowship, I practiced in the traditional model. I did teaching, but I also did private practice. And working there, I realized that patients do not have the access that they need. And for some of them was not convenient also to travel for long distances to come to see me. And on top of that, the time that I was able to spend with the patient was shorter and shorter. So for me, that I was an educator and interested to share more was very hard to squeeze all my intentions and spend the time with the patient. And later on, I also saw that many patients, they try to delay care because the cost of their, healthcare became more and more expensive. So I did thought about what I can do to change those things. So that's how I came up with the idea that we have the innovation here, we have the technology here. Why not use your phone, your computer to access the doctor? Actually, we carry these powerful tools in our pockets, and we do everything from banking to entertainment to our scheduling. Why not accessing the doctor? So that's how I came up with the idea.
Well, that's great. And, I'm sure a lot of people, anything specialty medicine, there's typically a long wait, whether it's, nephrologist, rheumatologist, cardio, whatever it may be. There's typically a long wait to see that specialist. And then to your point, if you live in a rural area, you may be driving, a couple hours because the access to care in rural to specialty, because doctors typically don't want to live in those areas. Tell me a little bit about how the model is different from, the first time a patient contacts you versus, the traditional model that you used to practice in where they would, come see you in person? How's that different?
So as you mentioned, rheumatology and specialties in general are very hard to access, but rheumatology in particular, there is a huge shortage of specialists across the United States and probably worldwide. And the time to see a specialist is between 4 and 6 months. So I try to cut down that time to less than a week or a week. That's the first thing. And then the time that they spend with the physician after waiting for 4 to 6 months is between 20 and 30 minutes if you are lucky to get that.
I was going to say, it's usually 5.
Yes. And usually from those 20 to 30 minutes, half of the time you spend checking out forms, filling out forms, signing, yes, and the time with the nurse. So that's something that I didn't like. And on top of everything, many of these patients are in pain, as you said. Sometimes they have conditions that could be life-threatening. And if you don't give them the access when they need it, then you put them in danger, but you also, not you, but usually the quality of life of these patients is tremendously affected.
Right.
So in my model, the time to access is a week, I would say. You spend all the time with a physician. You can fill up your forms at home whenever you have your time. And then everything is done in such a way to be transparent. I do not want to become a financial burden for my patients. So that's why I do not want them to be scared about how much the test will cost, how much the imaging will cost. So everything is disclosed up front. And between me and the patient, I can decide what is needed to be done right away or what can be postponed to meet their financial needs.
Yeah, I think in addition to the virtual care, the price transparency is really great because obviously in a physical location, you have to check some boxes for insurance that may not be needed. And, then you end up getting the bill in the mail of what you have to pay. So that's really great. So taking the provider side of things, having this virtual care rheumatologist practice, tell me about some of the benefits to you as the provider versus, we talked about the patient and not having to travel, but I know a lot of folks that own practices, post-pandemic, they went back to, for 3-4 months, they were doing nothing but telehealth. And then, a lot of folks that may not be as innovative as you from a practice standpoint went back to doing what they know of, having people walk through the front door. And a lot of innovative providers see better kind of work-life balance. They're able to see more patients, but spend more quality time. But tell me a little bit about, from the provider side, how how's it different for you as a provider of doing virtual care versus kind of in person?
So I think the biggest struggle of independent physicians is how to cover the cost of their practice. The overhead is very, very high in the traditional practice. And then you have to use a lot of staff to help you. Think about the person from the front desk, the person that has to take you to the room. And then on top of that, you have to use someone to bill or code for you. So that's additional cost. When you add everything up, you're going to realize the cost of care increases artificially because there is this disconnect. There are many layers between the physicians and the patient. And when you remove all these layers, the cost of care becomes much more affordable, and the time spent with the patient becomes valuable, becomes all between the patient and the physician. From my perspective, cutting down the cost offers me the possibility to spend more time with the patient.
Right.
Because if you have to pay more, and more people, then you have to cut from somewhere. And usually it's from the time that you spend with the patient to be able to see more patients, to generate more revenue. And in telemedicine, you have the ability to remove some of the intermediates between me and the patient.
Right. And I've heard from a lot of providers too that, in person, they're having to see, kind of 3-to-1 patients to make the same type of revenue just because of all those overhead costs when the patient's getting less time. But, with telehealth and removing some of those barriers from a reimbursement perspective, they're able to kind of have better work-life balance to see less patients but make more money. Has that been the same kind of for you in doing that model?
So, first of all, the patient, when the patient comes to us, they have to pay a copayment. And then after they leave the office, after you bill the insurance, many times in our days, patients have high deductibles, so they will be responsible for a huge amount in the traditional practice. But even in some conditions, some situations, they will be responsible to pay 20% of that amount. So when you add these things, when you add the copayment and you add what you have to pay, like you said, the surprise bill after a month that you saw the doctor, that will generate a lot of stress for the patient. And in the meantime, a lot of stress for the physician, because you have to pay the bills and you have to pay the people that you work with. In direct care model, the patient pays directly to you, but I don't charge anything extra. Whatever you see on my website, that's the price that you're going to pay. There is nothing hidden. There is nothing upfront. And usually the cost is done, the payment is done after you see me, nothing before. So I was really bothered when I was going with my kids. When I was going with my kids to the doctor, the first thing that they will ask me, not even greeting me, was my insurance card and my copayment. And that's stressful, that creates that disrupts that relationship between you and the office. And I don't think it should be this way. If I don't pay you the copayment, if I don't show you the card, my insurance card, you shouldn't give me care or provide me with care. I think that concept is very stressful for someone that is already in pain, that is already struggling with the health.
Right. No, that makes total sense. And you've been able, right now you're seeing patients across 6 states, and you're able to do that from your location without having to have physical offices in those states and traveling. When we look at the cost of a physical location, in a traditional model, for you to see 6 states, you'd have to have 6 office locations with front desk and nursing staff and whatever. And you're able to do that from where you are today. Tell me a little bit about some of those benefits. Obviously, there's the cost of physical buildings, staff, things like that. But then also, I'm assuming in the 6 states you're doing it, you're providing access, maybe that they have shortage in that area, or tell me a little bit about how that came about.
So the fact that patients can access a specialist from their location, it's a huge benefit to them. You don't have to travel. You don't have to pay the gas. You don't have to arrange for your kids to take them somewhere. You don't have to take time from your work. So you can schedule your appointments for whatever you are. And it's very true, as I said, in rheumatology, our diseases, the prevalence of our diseases is increasing. Actually, a few years ago, I've seen a statistic about at that point in 2015, there were about 52 million of people in the United States with arthritis. And it was predicted that in 10 years from then, it was 60 million and more. And another 10 years was 72 million. And out of those people, a third, they have problems to travel. They have problems to get to a doctor because of their pain, because of their deformities. So that convenience is second to none for patients. And then, as you said, many places in the United States, they have no specialists. Or, I had a few patients that they would have had to travel for 2 hours to go to a specialist and 2 hours back. So that requires a lot of time in the car, a lot of discomfort. And again, we come down about convenience. And telemedicine, it's all about access and convenience. And if we can make it all transparent and offer that in time, not to delay the care, I think we have achieved very important goals.
I bet you're starting to see younger patients with us all on computers. I mean, between my back and my arms like this all day long, I may be calling you. I'm always in pain. All these younger tech folks, you'll be starting to see your average patient's going to be like 40 in a couple of years. So, obviously with the pandemic, there was, a big uptick, and it put kind of telemedicine, 18, 24 months ahead from that standpoint. Everybody got used to doing video, whether it was school, whether it was work, whether it was with their doctor, yoga classes, whatever it may be. Where do you see kind of the healthcare and really like practice groups? What would your advice be? What they should be looking at now, and where do you see it in, a couple of years from now?
I think telemedicine is here to stay, will not move away, and it will expand. It will expand to be practiced by multiple physicians, and that's because the patients are, interested in that. A few years ago, when I was talking about telemedicine, everybody looked at me like I was talking about a unicorn, and they would be very concerned about how are they going to be paid. You can be paid. There are resources to be paid. I mean, you make the payments for your bank and for everything. From every bill that you have, you can do it through your computer. So the same was medical care. And I think, like you said, the younger generation is going to push towards implementing that. And actually, today, I heard that in the Congress, they are fighting to keep telemedicine ongoing, even after the pandemic.
Yeah.
So,
Yeah, and I've been amazed too, even with the senior care that they, had to use it during the pandemic to keep them safe, and, especially folks with chronic care. And it's amazing to me looking at like survey results across, a wide variety of practices. I think seniors were very hesitant, probably that first one of, hey, is there really going to be a doctor on the other side? And maybe with their phone or whatever, it was kind of, they didn't know what to expect that first time. But seeing the results, to your point of when you're talking about a senior traveling, typically you're now taking the caregiver out of work too. So if I'm taking one of my parents to, a thing, I'm taking off work, I'm traveling to pick them up, then I'm taking, with parents with chronic care conditions, you have all these Gen X's that are now taking care of their parents. So they're also making healthcare decisions based on convenience. So, when I was dealing with, my father had many chronic care conditions, I was making the calls on healthcare. So if that doctor offered telehealth and I didn't have to take off work and go pick him up, that's who we were going with. Because now you're talking about, especially in your industry, people that it's very hard for them to get in the car and they might need assistance, or they might have to have a neighbor drive them or whatever. You're now coordinating multiple schedules and multiple people getting off work. And so that collaboration too with caregivers on care and things like that, I think will become more apparent as you have, us Gen Xers making decisions for, our parents of, wanting to be on the telehealth visit to hear how to keep them compliant and what they need to do and things like that. I think we'll see a lot of that as well.
I have to agree. Chronic care is something that will be required. And as you said, it will involve many, many people, many layers. So I think that telemedicine will solve many of these issues. And, in rheumatology, many of the patients that I see, they do require chronic care. Why would you have to come to me to review your labs and just make small adjustments to your treatment when you can do that from the comfort of your home? So I think that the concept of care or medical care should be broadened at this point. And should be accepted that we have the technology, we just have to use it.
Right.
And even people that are elderly, they love it. I will tell you that, yes, it's scary in the beginning, but once they've seen that they can do it, there is no hesitation the second time.
Yep. Yeah, it's really that first time, just like anything, right? It's that first time of getting them over the hump and really making telehealth very simple for all patient populations. If you're trying to get them to download, where I see the biggest disconnect is when you're trying to get them to download an app and, they've got they've got the smartphone that their kid gave them or the grandkid, they don't know their, iTunes password to download an app or whatever. So it has to be super simple and to be able to connect with them. Well, Dr. Girnita, it's been a pleasure to have you on the show. Click in the show notes to find out more about Rheumatologist OnCall, what she is up to. She's doing amazing things, so make sure you follow her journey. As always, if you have any questions for our guests today or if you have any questions for the future, please drop us a note. And as always, subscribe to get your podcast delivered to you on Tuesdays. Thanks so much again for being on the show. We look forward to following your journey.
Thank you very much.
This podcast has come to a close. To hear more from the Executive Innovation Show podcast, subscribe, submit questions, and share the love. Follow us on social. We're everywhere.